It's very, very important to realize that there are several reasons to face a resistance to a clear discussion about this subject. The main reason, in my opinion, is because the hospital and the health system expend a lot of money by treating patients with brain injury for a long period of time. And by declaring brain death, they make a lot of money.
The companies make a lot of money with the drugs.
Not only the companies, so the hospital also.
The hospital, but the companies, a liver transplanted friend of me, he in 1 year he needs drugs for 85,000 euro.
Yes.
And all over the world make a lot of billions of money with all this medicament.
That's why it's so important what you are doing. It should be understood that this may be the main reason why those discussions are not allowed in medical forums. Most doctors don't know about what we are discussing here. Medical students are taught to follow diagnostic procedures, diagnostic protocols, treatment protocols. They are not taught to think about what they are doing. Medical doctors and medical students are not trained to be scientists, so they don't have a critical thought on what they are doing. So what we are discussing here is not taught in the medical schools. It's not explained in medicine textbooks. Medical students cannot read about what we are discussing now, but they can read in the British Medical Journal website. And if they did that, they would know that the transplantation system does not have answers to those criticisms. The importance of hormone replacement has been discussed only during the last few years. And this is not clear for most of physicians who is in charge of an intensive care unit. He does not know that those patients in coma are actually requiring thyroid hormone replacement. He's requiring adrenal hormones replacement. It's very important that we start discussing those matters in public in order to face the resistance, the natural resistance that occurs in medical forums as a consequence of this financial issue involved.
Why don't they change the criteria of brain death when they all know that from 2000 to now?
We have been asking that question in medical websites, like in the British Medical Journal website. And the answers that we got simply surprises us. They say that they cannot avoid doing apnea test because if the patient breathes in the operating room, that would be a disaster for the transplant surgeon. In no culture all over the world, a patient who is able to breathe can be considered dead. So that's why it's so important for you to take these discussions to the general public, because then medical doctors will have to be updated about the physiological issues related to coma. Those issues like the presence of hypothyroidism and adrenal failure in patients in deep coma were not discussed before. We have had those research results within the last few years, especially after the year 2000. And another important issue is that when you perform those tests like angiography to confirm the diagnosis of brain death, doctors that do this never thought about the possibility that when they don't see images vessel images in angiography, there is still some brain circulation left, and this circulation left is enough to preserve the vitality of the brain tissue. We have been able to discuss this in some medical forums, and including in international forums, and we have told those things to those who support the transplantation system, and we got no answers.
Some doctors know all about this. In Germany, I know a lot of doctors who say brain death is not true death. Yes, there are doctors. Do you mean that they are afraid that after 40 years they will say you killed patients?
Well, that's a speculation. We can speculate why some doctors are resisting to open discussions about that. The question about being challenged for spreading the practice of brain death and now realizing that they were wrong, this could be a reason too. I think that people have the right to knowledge, because if they know the situation, they can defend themselves. If they don't know what the real situation is, they are defenseless. And they cannot defend the defenseless relative who is in coma. That's why it's so important that you talk about those things and take that knowledge to the general public. You will create a demand for a more clear discussions in medical forums. Because as doctors or physicians are questioned by patients and their relatives, they will have to provide a comprehensive answer to those questions.
Do you think that the non-heart-beating donor method is better?
This is not correct, because we know that we can save the brain of patients who had a cardiac arrest for several minutes. You can induce hypothermia. This is published in medical literature. Patients that had cardiac arrest for more than 30 minutes, from 30 to 47 minutes, that was what was published. A number of patients that had cardiac arrest from 30 to 47 minutes, 50% of them recovered to normal life. 50, yes, when they were submitted to hypothermia.